Good afternoon. I'm delighted to be here today to talk to you about how we can prepare our cities for pandemics. But imagine this. Imagine if we built our cities in a way that had built in resilience for business and life continuity. And that's what the idea of the community block is all about. There's a wonderful quote by Arundhati Roy: "Nothing could be worse than a return to normality." Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It's a portal, a gateway between one world and the next. And that is my hope, our hope, that after the year we've had, what it does for design of our buildings, of our neighborhoods, of our cities will be so much better. We knew our cities had a problem when we started seeing worldwide of really foundational change. This is Times Square before and after the pandemic. Everything stopped. And the fragility of our cities became so evident. We realized, perhaps after a long time, that the health of humans, the health of systems, and our economic health was completely interlinked. And so we started asking ourselves some really fundamental questions. How can we keep cities sustainable, innovative, and accessible while creating resiliency in the face of future pandemics? Is it possible for us to survive the next disease outbreak without going through complete lockdowns? Can we conceive of a city block, a specific area of residents, business owners, even public buildings that share a common purpose, which is built on a foundation of health and wellness and is resilient to pandemics? In other words, can we maintain business and life continuity through a pandemic by design? And we really laser focused on communities because we realized that worldwide, and especially in the US, the approaches were either individual focused or really policy focused. But the missing rung was the community. And communities have the power to enforce guidelines and support individuals, not through laws, but through social bonds and physical connections. And that's what this idea of a prototype community block is, where you really start with the premise that the community is the health system, and you shift dependency from self-sufficiency to really interdependency, from rigidity to flexibility, and most importantly, from disparity to equity. So what you'll see me share with you is a range of strategies that start talking about how we can achieve it. At its crux, the concept of a community block is a community-based ecosystem that supports business and life continuity. It could be as a city block, it could be as a campus, it could be as a building. The evidence supporting it is from urban studies on one end and infection prevention on the other. And again, the same idea that life continuity is business continuity, and a resilient solution works for human, environmental, and fiscal health. There are 6 principles in the community block. 1, it should be self-sustaining to improve both environmental health and social health. 2, you have to have an integrated digital infrastructure where every footprint has a corresponding cloud print. So if you have to move from physical space to digital space and back again, you can do that seamlessly. The idea of circuit and circuit breakers, which really is something Singapore gave to the rest of the world, allows the community to contain certain sections while continuing business and life in others. It's a powerful concept. The idea of flexible and mobile infrastructure. We can no longer afford to have infrastructure that is only fixed. But if you have flexibility and mobility, you can have, when needed, rapid adaptation and decompression. Mixed use, intergenerational, and inclusive approaches can make so much of a difference, so that if one business takes a hit, the other can really fill in. The intergenerational concept as well. We know how our seniors and our aging adults were overwhelmingly impacted. But if the strongest in the community had been able to take care of them, then we wouldn't have to put all the pressure on healthcare systems. And then finally, all of this depends on health, housing, and education as the cornerstones that support business and life continuity. And to achieve these 6 principles, we have proposed 12 design strategies. And I really believe that these strategies will keep evolving. Many of you watching today will build your own strategies, but they range anywhere from locally produced food to mixed use multicultural community development to urban park networks rather than just having central green spaces, intergenerational zoning. Like imagine if senior living and schools were co-located and adjacent and could really compensate for each other. The idea of thresholds, we have seen how important in-between spaces have been. Finding a way of leveraging that, connector spaces become wonderful buffer spaces as well. Circuits and circuit breakers, being able to know what areas I can quickly close off, having net positive buildings so that you really are self-sustaining as a community. The half-mile neighborhood, a lot has been written on that. If you can really reach things you need without having to get on public transport, it makes it so much more resilient. Cloudprint support, we are no longer able to separate out physical and digital needs. It has to be an integrated approach, mobile infrastructure, the idea of having mobile carts, mobile clinics, mobile libraries, mobile schools that can be supporting the community normally, but can quickly reconfigure during a pandemic. Ventilation and daylight has become so important in this last year. And then thinking about mobility in multiple scales. So if one scale of mobility becomes at risk, you have other scales that you can rely on. Right? And the idea would be that if you followed these strategies, you would have a beautiful, healthy community, walkable, psychosocially supportive. These mobile pods could be distributed all over as mobile clinics, mobile art galleries, mobile libraries, mobile schools. The idea of urban farms that produce local food, really having visual and physical access to nature constantly so that you can improve mental and physical health. These are all not new principles, but when you bring them together, you create a foundation of health and wellness. And if you think about it in terms of pandemic resilience, you think about just 6 levers that you can pull. And imagine this, that when you are getting into a pandemic, hopefully we would not again, but if we do, or if we are needing it for the second or the third wave, you have 6 levers that you can quickly pull that are activated by the community. These are checkpoints and access, circulation and flow, making sure that access to essential services is maintained. During a normal mode, people go to essential services. During pandemic mode, essential services go to people. And that's where the mobility comes in. Program shift, being able to say, okay, when hospitals need more space, hotels are going to be able to give it. When senior living is compromised, schools can be that leftover space. Understanding all of your community assets and understanding and planning for resource sharing so that no one is overburdened. De-densification and pedestrianization and contact tracing so that you can contain quickly. But imagine if contact tracing is also mobilized by the community. So you are not really fearing for privacy as much because it's based on a trust system. These are all really simple levers, but you pull them and this wonderful block that you had just moves into pandemic mode and still maintains life continuity. So mixed use zoning, for example, allows a hotel to flex from a hotel to a quarantine facility. Homes have thresholds so they can see the community, they can visually connect, even though they're physically distant. There's limited car transportation, but you have pedestrianized streets to distribute essential goods. You can start immediately protecting your compromised, immunocompromised populations and immediately create almost a wall of defense around them without compromising their social health. One of the toughest decisions we've had to make in these times is that to keep someone physically safe, we have had to compromise their psychological safety. But if you build on a foundation of health and wellness and you think about what levers you can pull, you can maintain their social health as well. So all of these strategies and everything that I'm sharing with you is open source. You can avail of the full document anytime that you need. But this idea of thinking of a very flexible system that thinks through different scenarios, but because it's built on health and wellness, it can flex so easily. For example, what was an urban farm and a grocery store can just become a food delivery hub. And all these little mobile units that were distributed across your community now become centralized areas for testing, for tracing, for triage, maybe even mobile schools. When children can't go to the schools come to the neighborhoods. That's the level of flexibility and mobility that we need. The idea that I can go from normal mode to pandemic mode because I've built on health and wellness. And the other key component to making this work is you have to work as a system across the design continuum, all the way from apps. So apps that are for healthy eating, healthy lifestyles could be the same app a community uses for contact tracing. Natural light and indoor-outdoor schemes, those work in normal times as well. But during a pandemic, they become our lifeline. Ventilation and daylighting that you're providing with threshold zones also serve as buffer zones. So what you're seeing in the top row is what I would do for health and wellness. And what you're seeing in the bottom row is the ability to really give pandemic resilience with the same attributes. And this idea is not completely new. Right in your backyard, the Toa Payoh neighborhood is exactly like that. It's a high-density town that has supported business and life continuity, right? Because you had a mixed use plan and design overall, because you had pedestrianized streets and rooftops and food stalls and rec centers and urban parks and open spaces, that neighborhood could still continue. This range of affordances that were allowed in that block in the city allowed residents not to travel out of the community when it was dangerous and not to rely on public transport as much. The other piece that is fascinating about this neighborhood is about the really mixed ethnicity that it supported, the whole multicultural concept. And that's really, really important as well, because it gives you a COVID advantage when your needs are met within the community. Ventilation, solar panels, void decks, all of these have helped you in having pandemic resilience. Vertical farming, continuous ground floor parks, walkable neighborhoods, third places, ability to support different mobility devices. These are all ideas that thrive. Even a new neighborhood we're designing in San Diego right now has the same concepts, very mixed use, ability to translate, access to nature and daylight, access to air, ability to spatially be distant even when you're socially connected. So important right now. And all of these good design principles with digital infrastructure integrated make a difference because they allow us to shift between the physical and digital as needed. In the end, what we hope this entire year has taught us is 3 or 4 fundamental shifts. One, we have realized that I'm not just responsible for my health. I am responsible for your health, and you are responsible for mine. So we have to survive really as a community. We have to thrive as a community. The shift from aesthetics to synthetics, we know how we experience things matters. The shift from physical to digital and from physical to phygital, where you realize that our digital and physical realities are integrated. And most importantly, perhaps, even as we go through all of these shifts and understand that our worlds are so intrinsically interwoven that we are finally realizing in 2020 that a purely human-centered world will not get us where we need to be. We have to shift from being human-centered to living-centered and think like an ecosystem, really celebrating differences, celebrating interdependencies, and understanding that being a community gives us health, makes us resilient. Thank you so much for your time.